We're now going to turn to Dr. Claudia Hoyen, an infectious disease specialist at University Hospital's Case Medical Center. How are you?
I'm fine, thank you.
Let's start with what Sarah Dollop there was just reporting, and let's be precise. An individual turning themselves in and saying basically they think they have symptoms, they want that looked at. So we have no medical opinion yet on whether that might be any kind of second case. Walk us through how the medical authorities here deal with this, particularly these 40-some people that may have had some kind of contact with what is now the first deceased Ebola patient in the U.S.
I don't know if the person who turned themselves was one of the 48. I had not heard that. But I would think that anyone coming forward in a hospital with the story of having fever and also saying that they think they've had a contact with an Ebola patient, we would take that seriously, as I'm sure they are. You know, things that they're going to do is probably monitor the patient over the next several hours to see how things go, and also probably check some preliminary laboratory tests to see if there are any indications that there may be some clinical changes or some laboratory changes consistent with it. And again, I think that, you know, by monitoring these people who have had contact is, you know, it's really the best thing that we can do, and make sure that they really care if they do start exhibiting symptoms.
Is this an area where you would prefer some sort of false positives or folks being overly cautious in saying, I feel a fever?
I would think if, you know, if somebody came to me with that history, I would certainly be overly cautious. Because as we know, people are very frightened by this, and we want to be sure that we're doing the best for the patient as well. And so, you know, these are patients that we're going to want to take seriously and make sure that we are containing spread.
Yeah, and Doctor, on that note, Thomas Eric Duncan originally went to the hospital with abdominal pain and with a fever, but because he did not have all the symptoms of Ebola, he wasn't throwing up or had diarrhea, they ended up sending him home, not coming back for another 2 days. And a question I think on a lot of people's minds, would the outcome have been different had they taken him in the first time he went?
I think it's hard for us to say, looking back in time, exactly what would have happened to Mr. Duncan. I don't know all of the history that they got from him, so that would be another important piece of information for people to realize. But I think that, you know, now that we're aware that, you know, people are coming into the United States and could be potentially exposed, the rest of us are really making sure that we're asking those questions that were put out by the CDC in terms of patients with fever, abdominal pain, making sure that we are checking for any sort of travel history for them.
And Doctor, we know that Thomas Eric Duncan was receiving this experimental treatment. Can we read anything into the fact that that treatment obviously was not, sadly, successful here? And what is the current state of development of Ebola treatments in general?
I mean, I think that, you know, we're really in the early stages of this. I know that for some of the other people that they used for, they were already at a different point in their disease. So I think that it's really too early to tell. There, you know, have not been any clinical trials on this. And in medicine, sometimes we need to try things if we think they're going to work for people who are gravely and seriously ill. And so I think that by trying this medication on him is a good idea. But again, we don't know exactly when it was started in terms of his clinical course, and it may have just been that it was too late.
Doctor, this outbreak, this global outbreak, has been painful for the medical community. So far, 208 healthcare workers have died globally. Most recently, we have a nurse in Spain who has grown infected from trying to treat somebody who is infected. And Duncan's death reminds us that those of us in this country cannot keep everyone in this country safe, as I think we thought until he passed away. So why is it so many medical providers have passed away in this instance? And do you detect a sense of fear in the medical community that folks could try to go in and help as they're supposed to do, as they take an oath to do, and then get sick themselves?
You know, as you said, you know, we all take an oath. We all make a commitment to this field, and you know, we hope that we are strong enough to be able to help people in their times of dire need. Again, fortunately, in this country, I feel safer than if I were treating Ebola patients in Africa. I know that currently I have a lot of things at my disposal, and I have the resources to be able to protect myself in terms of keeping myself safe from the virus. So I think that even as a healthcare provider in this country, we're always diligent, and we're always trying to protect ourselves and our patients from spreading diseases. So I think that we'll just need to, get the strength and the courage, and I think that we are going to be fine.
Dr. Claudia Hoyen, thank you so much for your medical expertise here today. We do have all the angles on this story coming up, including we're going to